explosion? And what are your symptoms?
Coughing, shortness of breath. She was
Miller,
right
you
by
need
the
help
explosion.
All doctors to the ER.
Send her back into isolation, C&D.
Okay.
All doctors to the ER.
Help, I need a doctor over here.
Ladies and gentlemen, introducing a dancer named Do It, is in the house to dance. Go do it, go do it, go do it, we like to dance. What happened?
This is the emergency broadcast system. There has been an explosion at the Chicago South Water Plant that has resulted in the release of chlorine gas into the air. Immediately shut all of your windows and turn off your air conditioning. Do not go outdoors until further notice is given. If you are experiencing any type of breathing difficulty, nausea, or vomiting, please call 911 immediately and an emergency vehicle will arrive for you. If someone in your household is unconscious, please refrain from going outdoors, which can worsen their condition and may affect your health as well. Please perform CPR to anyone in your household that is not breathing until an ambulance arrives. CPR instructions can be viewed at www.cpr.net. Please stand by for further instructions.
Mommy, what's happening?
Outside of the emergency department of the Northwestern Hospital with some breaking news. We had reported earlier around 9 a.m. that the city of Chicago and the Chicago authorities had reported an apparent explosion at the Chicago water plant around 8:30 this morning. It appears that this explosion was a rather mild explosion and it has resulted in a chlorine leak, and as of right now we have not received any statement of how or who could have caused this explosion. We had word earlier from the Chicago Fire Department that this facility is heavily guarded at all times due to the massive supply of chlorine on site, making it a prime target for the terrorist attack. The hazmat team is on the scene right now working on this problem as we speak, but Mayor Daley is ordering that the city be evacuated immediately, and this is including the surrounding suburbs within 100 miles. As you look behind me, you can see that there are patients in distress in result of this chlorine leak. Most of these patients are flooding in from the taste of Chicago with the common symptoms of shortness of breath and respiratory distress. I'm going to see if I can get a statement from one of the doctors on the scene right now. Excuse me, doctor, can I have a word with you for a second, please?
You know, we're real busy now. We got a patient.
No, just be for a moment, just for the viewers at home.
Okay, real quick.
Oh, hey, could you please tell me and the viewers at home how to avoid this contamination that's going on right now?
The most important thing is keep the windows closed. Do not go outside. Chlorine gas stays low to the ground. It gets in the sewer system. Some of the symptoms you could be experiencing is eye, ear, nose irritation. You get a respiratory tract infection. You could be vomiting. You could have a lot of secretions, and basically you could be nauseous. And it's not contagious. The only thing is make sure if anyone has been outside or near the area, to take the clothes off, and because it is untouched, it can get some symptoms.
And is there a treatment as of right now for this?
Not right now. We're still trying to work out the details.
All
And
doctors to the
figure out how big this catastrophe is. I mean, the explosion was small, but the whole vicinity there, Navy Pier, anyone by the Taste of Chicago, any joggers, fishermen, they need to go to their local hospital. Because even if you feel all right now, it's very dangerous to the respiratory tract. So I gotta go.
Okay, thank you for your time. Okay, and there you have it. I'm Danielle Dale, signing off for Fox News. Thank you.
Mallory, come over here and get them into C&Z isolation immediately.
We're by the explosion. Mallory, do you have tape? So that like no. Yeah. Side of her face or here, this side or whatever.
I'm going to see if I can get a word with one of the physicians right now and see if she can tell me what's going on. Is there any available physician? I'm going to see if I can get a word with one of the physicians right now to see if they could tell us how to avoid this attack that we seem to be undergoing. Excuse me, doctor, can I get a word with you for a second?
Yes.
Could you tell the viewer? Do it. Go back. See if I can get a word in with one of the physicians regarding this contamination that's happening right now. Excuse me, doctor, can I come over here? Get a word with one of the physicians here. Excuse me, doctor.
I'm sorry.
Stop. I'm going to see if I can get a word with one of the physicians right now. Excuse me, doctor, can I get a word with you?
Yeah, you know, we're kind of busy here.
Just take 1 second.
Okay.
And your name is?
Dr. McTwotype.
Get a word with one of the doctors right now on the scene. Excuse me, doctor, could you come over here for a
No,
second?
you know what, we ain't got time.
It'll just be a quick interview just for the viewers at home.
I'll be back.
Okay, and your name is?
Dr. McTwotype.
Okay, could you please tell us how...
Just go with it.
Try it again.
And if anyone got infected with this, make sure you take the clothes off. It's not airborne. And that's it. I gotta go.
Doctor, you're too tight.
God help us.